What's going on, everyone? Happy Thursday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had taken a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Thursday edition of the Pandemic Update for Thursday, September 19th, 2024. If you're new to my channel, welcome to my channel. This is where I do the daily pandemic update on all things COVID and any other virus that could be a health threat to you. Let's face it, there's a lot of different viruses out there. COVID came around in late 2019 and, well, really became a thing in 2020. And ever since, it has not gone away and it continues to mutate and spread and produce new variants. It's something we're all tired of, but it has not gone away. And other viruses are an issue as well. I talk about that on my channel as well to keep you informed with what is going on with all these viruses. Want to stay informed? Subscribe down below. If you like today's video, give it a thumbs up, hit that notification bell to be notified of my latest updates, and of course share this video with anyone you know and leave your comments down below. I assume there will definitely be some comments on what I'm going to be talking about today, which we're starting off with a little bit of news on a potential new variant for the United States. Yes, starting to show up in small numbers, but it's something you've heard me mention before. We're going to talk about it a little bit today, and that is the XEC variant. And I've been finding a few things here and there. And I just found this from Alexander Tin, who tweeted on X saying at least 25 states have all spotted a case of the XEC variant. Many of them are from CDC airport COVID testing. Yes, they have been testing for variant sequence at some airports. Some of earliest are from patients in Virginia. And take a look at this. You can see here, New Jersey, and now they're sequencing at Newark Airport. New Jersey already has 15 cases, California 12, Virginia 10, New York State now up to 9 cases. And mind you, we do such a small sampling of what is going on with our variants in wastewater, testing, whatever way we're doing. We just don't do a lot of it. So these numbers are likely to be an undercount of what's actually going on. Ohio has 8 cases, Delaware 8, Arizona 6, Washington, Utah, Nebraska all 5, and then there's a whole bunch more states, including my own state, which already has 2 cases of the XEC variant. Alright, moving on to this now. I tweeted this last night. This is a news story. I'm not going to read the whole news story, but there's something in here I want you to see, and it shows up a few times within the story. I put, this is not good, and more of a reason to get the new COVID booster, and that's because COVID sufferers have never been this sick, as they detail symptoms amid the XEC. That's the headline that the article read, and man, some of the people that they talk about in here, it's not good. And let's read this one. A third person echoed the sentiment, saying they struggle to walk after testing positive for the virus. I tested positive for COVID on Wednesday. They wrote yesterday I woke up with an achy back. Today I cannot walk. Read that again. I cannot walk. But then it says this. Of the 5 times I've had COVID, this was never a symptom. We are in for a long winter with these mutations. And there's been a lot of people saying that they've never been this sick during the summer wave. There's several reasons why that could be. Not necessarily because of a more severe variant. Early indications are, and I probably shouldn't even say this, that XEC may not be more severe. Here's the problem. Some people have not had a booster in a very long time. Some people never got a booster since the original vaccination. And then some who have had COVID for, I don't know, many times, such as this person, 5 times. Your chances of having more severe disease or long COVID rises with each infection. There's been several studies that show this. More so, the chance of long COVID rises, but you can get more sick each time you get COVID. Some people get it the same each time. Some people have it once, and then it's no big deal the second time. But then you also have cases where each time someone gets it, it gets more severe. It really just goes to show it impacts everyone differently. So, XEC, that is a COVID variant that we're watching. Alrighty, let's go back to the early days of the pandemic. Just for a second. This was a study, and its focus was on Sweden. And I thought this was really interest. The study is called Self-Reported Body Function and Daily Life Activities 18 Months After COVID-19, a nationwide cohort study. It included 11,955 individuals on sick leave due to COVID-19 during the first wave of the pandemic in Sweden. They were invited to answer a questionnaire regarding experiencing negative changes in body function and daily life activities approximately 18 months after the start of sick leave. And I just want to read just a little bit here. We're not going to really read the whole thing on video, but read this. Of the 5,464 responders, 45.7%, and then it says 4,676, 85.6%, reported experiencing at least one problem with body function, and reported prevalence of problems with daily life activities was 46%. The most frequently reported problem was fatigue, sleep, and movement. In general, women and those initially hospitalized reported more problems. So, yeah, this is really not good. And it says, in the regression analysis, problems with body function could partly explain whether individuals experience problems with daily life activities. However, only fatigue and movement significantly contributed throughout all groups. Furthermore, the odds ratios for fatigue were larger in regressions for women than men. So that's interesting. Women fared off worse than men. If you want to read this full study, I will post it to the archives of studies on my website. We're not going to sit here and read all this on video. We'd be here for an hour. Anywho, yeah, just more of the reasons why catching COVID can be bad for you. Alrighty, just a quick reminder here in the United States, COVID-19 testing. Free COVID tests are coming back again soon. This is coming from, and you can see it here in my address bar, this is coming from the government website, coming soon. Order your free COVID-19 test at the end of September 2024. Good idea, because we know there's going to be a winter wave that does come, probably of the XEC variant unless something else pops up. And yeah, you want to make sure you're stocked up on tests. Alright, I need to refresh this. We do have the new update today from the UK. Here it is. I'm seeing it for the first time as you. I just remembered it because, well, it's the next thing in my list of tabs to go through, and I just reminded myself, hey, it's Thursday. We need to look at UK. And the UK, cases went up ever so slightly. You can see here on the chart. It's not rising that much, but just a small, minor rise. 1,659 cases were reported, and that's up by 58, 3.6%. We've been seeing tiny little rises week after week. Deaths, 101. That's actually just down by 1. And patients in healthcare, this is down by 6.6%, down by 104. That's 1,465. We've been watching deaths in healthcare go down for the last couple of weeks, which is some good news. Heat-related illnesses, still a problem in the U.S., not as bad as they were last month. Hopefully we will see this continue to drop, but we'll have to see. Still a fair number of counties dealing with heat-related illnesses at this time. Taking a look at the pollen levels today, 41% of the United States is in the medium status. Let's take a look at what's going on with air qualities, and they're not terrible. They could be better, and we do see some green in some places, which green, as you know, is some good things. That means you can breathe easy, but take a look here. You can see there are some areas that are yellow. Great Lakes is yellow. Much of the Northeast is yellow. Even some oranges popping up. That's not good. And some yellow and a few oranges and reds popping up on the West Coast. Even the Southeast does have some yellow as well. Alright, want to learn more about climate and weather? Climate Data Report is your place for that. Over on X, I do tweet there. Maybe I'll tweet something there this evening. Alright, still not happy with this. Another day over 800 EMS calls in Philadelphia. In fact, it was 849. I don't know, is this going to be the new normal now? That we're just going to be more times than not over 800? I mean, it's getting ridiculous that we are just this high constantly. A live look in Montgomery County shows not as busy as it was when I looked at this 15 minutes ago, but I'm seeing strokes show up here a couple times. Cardiac emergency a few times. There's been a lot of cardiac calls today, and I've seen cardiac arrest. I've checked this several times today. I've seen cardiac arrest show up multiple times today as well. Not seeing cardiac arrest right now. Respiratory emergency has also showed up many times today as well, and there's 3 of them right now. Wow. Chester County, Pennsylvania. You almost have to put a scroll bar. There's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16 active calls right now in Chester County, Pennsylvania. And how many of them are sick person? 1, 2, 3, 4 of them are sick person. Respiratory difficulty a couple times. Stroke is showing up. It's just really busy right now, which is leading us up to something. This is Pennsylvania's update. And I'm learning something with this dashboard. I'm quickly learning something. We cannot always go by what the colors show on this map. See how it says 15-day trend? Well, we never once saw it say 15-day trend show a large increase for Center County, Pennsylvania. We'll get to that in just a moment. I mean, the majority of the state is showing no change. We do have increase being listed up here in Monroe County, Pennsylvania. But I wanted to take a look at State College today. It's an area I do follow a little more than others sometimes, and I wanted to take a deeper look. I just happened to have some time while I was out and about doing my thing this morning, and, well, I found something concerning. I tweeted it. Center County, Pennsylvania just peaked at the highest level ever seen on the PA COVID dashboard. And mind you, this dashboard itself goes back to 2023. I don't know if they were ever higher prior to that. They may have been, but for the sake of the dashboard, it's the highest since they started migrating to this dashboard. Take a look here. Yeah, it's the highest ever seen. You can see here, and there's 3 wastewater sites. All of them were really high, higher than the winter wave of last year. Now, let's read on. Notice this happened right when PSU, Penn State University, went back. Also, this happened at all 3 wastewater sites in the county, College Township, and both State College sites. And yeah, I put COVID is not over because it's not. Look at this. So, again, we never once saw it say on this map, large increase. We saw it say increase, but we didn't see it say large increase. And again, look at these charts. You can see what it did here, August going into September. I think that justifies as a large increase. All right, the viral activity level in Canada today is moderate. Flu A, Flu B, and RSV is low at this time. Real quickly, Walgreens this week, the national positivity rate is 26.2%. That's down by 3.7%. Total test was actually up slightly, 10,996. That's because, I believe it's because more states were added on here. All right, we do want to take a look at something in wastewater today, but I think before we do that, let's go to some state data, some of the notes for today. And let's see, that's from yesterday, but all this is from today. COVID, state data provided by CJS 83172. He puts comments after the videos, and he did it again last night. Thank you so much. So I want to read off to you the numbers that he is finding. Florida yesterday had 1,068 new cases and 49 new deaths in their daily update. New Jersey, 845 new cases and 3 new deaths in their weekday update. New York State yesterday, 1,372 new cases in their daily update. And we're going to be looking at New York State in just a moment. And I got to tell you right now, not liking what I'm seeing. There's a little bit of a surprise in New York State. Puerto Rico, 437 new cases and 7 new deaths in their 6 p.m. update yesterday. Arizona had 2,335 new cases and 11 new deaths. That's a weekly update. Colorado, 2,272 new cases and 14 CDC reported deaths. Delaware, 404 new cases. Indiana, 2,601 new cases and 10 new deaths. Michigan. Oh, this is horrible. I think this is your highest number of this current wave. 5,309 new cases and 31 new deaths, including 2 from 2023 and 3 from January through March of 2024. New Mexico, 845 new cases and 8 CDC reported deaths. Nevada added 841 new cases and 11 new deaths. Oregon continued decreases, this is good, in test case positivity rates and 7 new deaths. Tennessee, 2,832 new cases and 21 new deaths. Washington, 2,901 new cases and 25 new deaths. Early guess, we're going to be at or above 1,000 deaths yet again this week, which I think, if memory serves me correct, will that now be our 6th week? I don't even remember. It's been a long wave. All right, going back now to wastewater and kind of building you up to the New York City area, I want to show you a wastewater site in Stamford, Connecticut. And you can see here, it was dropping, but now all of a sudden, seeing there's a little bit of a rise once again for COVID in wastewater. So that's interesting. We have to keep our eyes on it. Everything else is not too concerning as of yet. And let's take a look at the regional trends. You can see here on the regional trends, all regions, well, there's a wonky movement upward in the Northeast, but all regions are dropping. X out that wonky movement for COVID. You can see even the Midwest is starting to drop at this time. RSV, you can clearly see here, this greenish color here, this lightish green color. RSV in the South is now starting to rise. Influenza A, Influenza B, not rising yet. HMPV is not rising. And norovirus is not much of an issue just yet, but it is starting to rise in some areas, more so in the South than other areas. Alrighty, moving on now to New Jersey, and we'll go over that George Washington Bridge to New York State, and we can see here that 70 out of 70 hospitals are reporting today, 493 hospitalizations, which is a drop over yesterday, 13 people on a ventilator. In the ICU, 60 discharges at this time are at 88. Taking a look now at New York State. Surprise, New York State had an increase today. A rather decent-sized increase, bigger than expected. So last week on Thursday it was 2,192 cases reported. Today it's 2,522 new cases reported. Mind you, New York City is added in today, but yes, it's something we're going to have to keep an eye on. My best guesstimate would be, guess what? Back to school. And the fact that, remember, New York City did have, or New York State in general, did have that LP.1 variant, and now maybe other variants are starting to knock on the door. It's something we're just going to have to keep an eye on. I'm not going to predict where this is headed, but right now, it is a little concerning to see that they had such a large, unexpected increase this week. Hospitalizations still remain higher than any point last week, though they are lower than yesterday, and that's some good news. 1,087 people hospitalized, 113 people in the ICU. Again, New York State is just something we're going to have to keep an eye on. I'm not expecting anything major at this time, but who knows? I really don't want to give any projections just because the fact that it's really a unpredictable situation at this point, especially with XEC now coming into the picture in small numbers. We'll have to see when that causes a wave down the line. All right, taking a look at Ohio. Mixed news today. The good news is cases dropped a significant amount. 8,391 cases reported versus last week's number of 10,315. However, in the state of Ohio, the number of people that have been hospitalized, the new number added to their total, did increase this week to 311 more people hospitalized. Remember, Ohio doesn't give a current total of hospitalizations. They just keep adding to their total tally since the pandemic started. And the ICU, that's up to 13 this week. And the number of deaths didn't really change much. It dropped by 125. So again, hospitalizations higher, 311 versus 281 added the previous week. And ICU, that's slightly higher. And the number of deaths didn't change much. So again, though cases are dropping, we do know these other things do lag, and wouldn't surprise me if next week they might even come in with higher deaths just because that's the last lagging indicator of a wave other than the funeral, which comes after someone unfortunately passes away of COVID. Taking a look at Colorado, yeah, your hospitalizations went up again. They went up by 9 to 172. Emergency department visits diagnosed with COVID, that's down by 0.2%. And that's currently at 1.4%. The positivity rate dropped by 1.2% to 12.8%. Cases reported this week, 2,265. That is down by 203. And real quickly, I just want to show you the latest variant that is dominating here in the United States is the KP 3.1.1 variant, which is still at 52.7%. We'll have new data tomorrow. We won't get a variant update until next week. I don't know if that's going to include XEC or not, but probably in the near future, it will be showing up on the United States map. Alrighty, folks, that does it for the Thursday edition of the Pandemic Update. Remember, my website's datareport.info. Subscribe to this channel down below if you want to see more updates. Give this a thumbs up, hit that notification bell, share this video with anyone you know, and of course, leave your comments down below. I will see you all again next time. Until I see you again next time, Stay safe, everyone, and have a fantastic Thursday evening. Thanks for watching.